Today we're going to look at herpes simplex encephalitis, which is the most common cause of acute encephalitis in the United States. It accounts for about 10 to 15% of cases of encephalitis. Encephalitis is an acute inflammatory process of the brain tissue. With herpes simplex encephalitis, the pathology starts with local necrotizing hemorrhage in the brain. Over time, this process becomes more generalized, leading to edema and swelling. As the inflammation progresses, there is also a gradual deterioration of nerve cell bodies. This combination of hemorrhage, edema, and neuronal loss explains why patients present with such significant neurologic changes. Clinical manifestations. The initial symptoms are often nonspecific, but should raise suspicion. Fever, headache, confusion, sometimes hallucinations. As the disease advances, focal neurologic signs appear, depending on which areas of the brain are involved. These can include behavioral changes, focal seizures, dysphasia, difficulty with language, hemiparesis, weakness on one side of the body, altered level of consciousness. The key here is that symptoms reflect the areas of cerebral inflammation and necrosis. Several tests are used to confirm the diagnosis. MRI is very helpful because it shows hyperintense bright areas of inflammation. EEG often shows diffuse slowing or specific temporal lobe changes in most patients. Lumbar puncture, CSF analysis, usually shows high opening pressure. Protein levels are elevated. Glucose remains within normal limits. The most important test is polymerase chain reaction, PCR. PCR detects HSV-1 DNA in the CSF. It's extremely accurate with about 95% sensitivity and 99% specificity. This is considered the standard for early diagnosis. Medical management. The antiviral agent acyclovir is the treatment of choice. Early administration is critical. It greatly improves the prognosis. Acyclovir works by inhibiting viral DNA replication. Therapy usually lasts up to 3 weeks to prevent relapse. It must be given IV slowly over 1 hour to prevent the drug from crystallizing in the urine. The dose is adjusted in patients with renal impairment. Nursing management. The nurse's role centers around assessment, comfort, safety, and support. Neurologic assessment is ongoing. Any changes in eloque, behavior, or seizures are documented closely. Comfort measures. Keep the room quiet, dim the lights, limit visitors, and group care activities to avoid overstimulation. Analgesics are given for headache, but opioids are used cautiously because they can mask neurologic changes. Seizure precautions and injury prevention are essential, especially if the patient has altered LOC. Monitor for renal complications from antiviral therapy by tracking urinary output and lab values such as electrolytes and kidney function. Finally, provide emotional support to the patient and family, as this illness often causes significant anxiety and distress.